Hello, everyone. Happy Tuesday. I'm so excited for our live session, Sodium and Chronic Kidney Disease, or CKD, revisiting new reports. I love talking about salt, and if you've attended any of my other live sessions, you've probably heard me say this before, that it is a low sodium diet, not a no sodium diet. And I'm so excited for talking a bit about what some of the new recommendations and some of the new reports are that we've seen. Maybe you've heard about them, maybe you haven't, but I'm excited to be covering them tonight. So thank you for joining. Those of you who are here live, let me know that you're here. Give me a wave, say hello. If you've caught the replay, let me know that you watched the replay. I love doing these live sessions because if you are in this community, there's 1,500 of us here. You're probably here because you've Googled something about nutrition, and whenever you read things online, especially about CKD, it's all about the reducing sodium, and that is really important. But one thing to know is it's a low sodium diet, not a no sodium diet. And so sometimes when we read things online, it can be super confusing. And that is exactly why I have this community. So kidney support, nutrition, recipes, and tips for CKD, because I'm a registered dietitian, and sharing nutrition information that helps us to preserve our kidney function is so important to me. So thanks for those of you who are here watching live. While you're here, if you're here, let me know if you follow a low sodium diet. Maybe just give me a yes or a no or a thumbs up in the comment section. Sodium is a mineral. We often talk about calcium, potassium when we have chronic kidney disease, but sodium is a very important mineral as well. It's actually an essential nutrient. That means that our bodies need to have a certain amount in order to be healthy. And we actually need to get this from our food in order to stay healthy. We often think about sodium for fluid balance, right? Like to minimize swelling. We also think about it in terms of blood pressure, right? Too much salt can increase our blood pressure in our body. But sodium is also actually important for our muscles. It's important for our nerve impulses as well. And so when we think about a sodium diet, when we have chronic kidney disease, we need to think about all of these different aspects as we kind of make a decision towards how much salt we're having. Too much salt can cause fluid to stay on our body, can cause swelling, like shortness of breath, but not enough salt can cause our low blood pressure, can cause us to be dizzy, and we definitely don't want to have that. So finding this balance for sodium is really important. Most Canadians, you've heard me say this, we eat about 3,600 milligrams of salt per day, and we don't even realize that. But the World Health Organization actually put out a new report last month, and that's really what inspired me to do this talk. Is it actually looked at all of the different countries in the world, and it's actually the first of its kind to do a report on sodium reduction. And what they found is Canadians are still consuming about 3,500 milligrams of salt per day. And what the World Health Organization is, they've recommended a 30% reduction in sodium in Canada by 2025, because we know how much salt influences our kidney function, our blood pressure, and our overall health. When we think about ways that salt can be kind of in our diet, right? We think about, those processed or packaged foods, and typically that's about 75% of the foods that we're eating, right? So cheese and deli meats and sauces and soups or packaged foods or restaurant foods. And then 11% of the foods, they come from that salt shaker. So, salt that we're adding at the table, salt that we are adding in cooking. And then the remaining amount comes from naturally in food, like, for example, dairy products like milk. It's going to have some salt in it naturally. Bread, going to have some salt in it naturally. And so when we think about, where we're getting our salt, being able to read food labels can be really helpful at lowering our sodium intake. And when we think about, how much we should be having with chronic kidney disease, we really want to target that 1,500 to 2,300 milligrams per day. And this is going to look different for everyone, but remember, it is a low salt diet, not a no salt diet. And that 2,300 milligrams of salt is the same amount as a teaspoon, right? The tip of our finger. And it doesn't really matter if it's table salt or pink salt or Himalayan or anything else. It's all of it has pretty much the same amount of sodium when you break it down. With table salt, you obviously get the iodine. With the Himalayan or the pink salt, it might be larger flakes, so you might use less and still get the same taste. But at the end of the day, low sodium diet. So the portion size of how much you're using when you're cooking, it's only 11% of our diet, right? We need to target some of those things that have more of that impact on our foods. So if you are here watching live, let me know if you read food labels. So give me a yes or a no, or a thumbs up or a thumbs down to let me know whether or not you read food labels. It's obviously found on all of those packaged products and drinks, and it's one piece of information on it. This sodium is so helpful. If we want to aim for 2,300 milligrams or less per day, foods that have 10% sodium or lower per serving is really important. So we can use that 10% to help us understand, if there's a little or a lot. So for example, if a food has 1 cup is their serving size and the salt is 20%, if we have half a cup, that's a small amount of salt. So we can use the food label to adjust how much we're having of the portion size of things to really help with it. These packaged foods, they also have nutrient content claims on them. So I'm not sure about you, but sometimes I go to the grocery store and they've changed the labels and there's so many different options all the time. Do we want things that are lightly salted? Do we want things that are reduced? Do we want things that are low in sodium? Do we want things that are saying no added salt? Do we want things that say free of salt? And what do they all mean? There's so many ways that these nutrient content claims can be on foods. It's no wonder that we get confused when we're grocery shopping. So I'm going to break it down for you. Free of sodium means that there's less than 5 milligrams of salt per serving. So this is a good product. No added salt means that there's nothing been added to it or ingredients that contain sodium. So also a good product. Low in sodium means that there's less than 140 milligrams per serving. So also a good product. Things that are reduced in sodium only mean that it has 25% less than a regular product. And lightly salted has 50% less than the regular product. So reduced and lightly salted, they can still have a lot of sodium in them. And that is why looking at the nutrient content claims and reading the food labels is super important, because we want to take a look at how we can reduce the salt in these packaged foods. And I know that when we're following a low sodium diet, understanding how we can still flavor our foods with great taste is still so important. So, earlier talking about garlic, right? Garlic and onion, super delicious seasonings. They have tons of flavor. Leeks, paprika, chili powder, cumin, all of these very flavorful power punchers when we're cooking. Basil, black pepper, these are often really great things as well. Depending on what type of dish you might be having, like maybe you're seasoning rice or potatoes or popcorn, you might want to do like paprika, garlic, onion. Sometimes I do a little chili as well. If you're doing more Greek or Mediterranean inspired dishes, those of us who are following a Mediterranean style diet, maybe you're using turkey or chicken or tofu, that oregano, basil, black pepper are really great seasonings as well that are low in sodium and give a lot of punch to your foods as well. So, when we take a look at this World Health Organization report, which was a very comprehensive report, the biggest takeaways that they recommended were to reformulate foods to contain less salt. but also setting targets for the amount of salt in foods or in meals. And if we have chronic kidney disease and our sodium budget is 2,300 milligrams per day, maybe we try to keep each meal to around 500 or 600 milligrams. That allows us some flexibility in our foods, but still gives us the opportunity to enjoy the taste of foods, right? Low sodium, not no sodium. Some of the other recommendations they have are, looking at foods in public institutions like hospitals, schools, workplaces, and trying to limit salt in those kind of more prepared foods, right? Same with if we're eating out, having front of package labeling or labeling in general that helps to kind of see where the sodium is. In Ontario, if you go to a restaurant and it has more than 10 locations, they're going to tell you the nutrition information. And that is really helpful to allow us, if we are eating out, to make lower sodium changes. The last time I looked at the report, there were some countries that have committed to making recommendations to lower the amount of salt in their foods and to make things a little bit healthier for their kind of their population, right? The World Health Organization made this sodium scorecard, which I think is a really, really cool tool. And we do have voluntary measures to reduce sodium in our supply chain and can encourage consumers to make healthier salt choices. And, being in Canada, it's a great opportunity to read food labels and, eat a healthier diet, because we know how much salt influences our food choices, right? So not only do we look at things that are salty as being tastier, because it takes about 14 days for our taste buds to change when we follow a low sodium diet. So we have to kind of stick with it. But also we know that high salt diets, they put us at risk of kidney disease. They put us at risk of high blood pressure, which also puts us at risk of kidney disease. They put us at risk of stroke, and so many other cardiovascular conditions. So limiting our salt, not avoiding it, is important. I'll share the report for anyone if they are interested. Haven't seen any questions come through tonight. And then one question I always get is, how do we still incorporate things like cured meats, like prosciutto, or pickled things like pickles or olives, things like that? And I think the biggest thing is reading food labels is the most impactful. Looking for those lower sodium foods, but also trying to choose things that are close to that 10%. So that kind of keeps us on track throughout the entire day. If you're looking for more information about sodium or making some changes to your diet, remembering that it's a low sodium diet, not a no sodium diet. When we don't have enough, we can feel dizzy, we can feel weak, our blood pressure might be too low, and speaking with your dietitian or your doctor to make adjustments is really important. But managing your sodium intake if your blood pressure is high, salt is one piece of the puzzle, but also your nutrition, right? So adding in those vegetables and fruits, things like the DASH diet are really helpful at lowering blood pressure as well. And, a dietitian like myself, through my course, The Kidney Connection, which teaches you how to preserve your kidney function, you get support from me, you get meal plans, you get resources, cooking demonstrations, and also community for those who are living with chronic kidney disease. So, sodium and preserving your kidney function is one piece of the puzzle. And definitely that's what this community is about. And happy to share how we can continue preserving your kidney function and making foods taste good, because that's really what it's all about. So awesome. I have shared a few resources in the chat or in the comment section, but I'm always here to answer questions. So thank you for those who were here, gave me a wave, said hi. I love doing these sessions, so always give me your questions afterwards if you do get any. But I hope this was insightful to understand that Many countries are struggling with sodium, and it's important that we make nutrition changes so that they're personalized to us based on our nutrient needs, our blood pressure, our overall health. And really, that's where a renal dietitian can help you. So, thanks so much for listening, everyone. Have a great night.